school bullying has reportedly increased under President Trump. The Trump DOJ narrowed the definition of domestic violence to only physical aggression in 2019, ruling out psychological aggression. The Trump administration has not reauthorized the Violence Against Women Act, which had been partially credited for a 60% drop in reports of intimate partner violence from 1996 to 2010. COVID-19 has been a stressor, a destroyer, and a growth challenge. The hidden pandemic of intimate partner violence has been exacerbated. Reports on calls to hotlines are mixed. There are reports of increased calls and others reporting a 50% drop, likely due to the difficulty of making private calls during isolation. And it's hard to find substantial data on actual violence, but experts are expecting a significant increase in IPV and homicide because disasters in the past have exacerbated violence, and COVID underscores risk factors for domestic violence. Moreover, these risk factors are much worse for marginalized communities, so outcomes for domestic violence will likely be worse for minority communities, just as outcomes for other physical and mental health challenges are worse in the BIPOC communities. Isolation increases opportunity for psychological aggression, control, and coercion. Financial stresses are a known risk factor for domestic violence. Psychological stress is also a risk factor for domestic violence. There was an uptick in IPV during Hurricane Harvey, for example. 1 in 3 women and, as mentioned, 1 in 10 men experience spousal abuse in their lifetime, and IPV cuts across all ethnic categories. Of course, men have to be held accountable for aggression against women, and violence is totally unacceptable. But we also have to create space for men to come to terms with their own inner lives and emotions and their own histories of childhood trauma and abuse. Racism has disempowered and devalued BIPOC men in America, and this is an added psychological stress. We have to deconstruct racism, even as we deconstruct masculine entitlement to power. But men have emotions and are vulnerable, and the culture has not seen this. Psychologists have pointed to a friendship crisis among men, and men are often more isolated relationally than women. Less relational experience leads to worse understanding of how mutual relationships work. Anecdotally, the pandemic seems to be shifting the environment around men, allowing them more room for vulnerability and relationship. As a psychiatrist and humanist, I hope that we can all work to create an equitable society where all have access to the all-important human journeys of identity, belonging, and wellness.